we are here today, part of our Sex and the Spine team are here today to talk about lube. It's the Lube Tube. Hello, everybody. Right,
Oh.
there you go.
Hello.
On camera. It's the Lube team, the Lube Tube team. So hello, my name's Rob Speranza. I'm a filmmaker in Sheffield. I run the South Yorkshire Filmmakers Network, and I've been making some films for the Sex and the Spine team for the last couple of years. I'm here today to moderate this group, and we're talking about lubes. We got a great team, a very esteemed team with us today. Let's have a chat with them each now and just find out who these people are around me. So, Michelle, I'm going to start with you. You're on my side over here. Hey, Michelle, who are you?
Hi, I'm Michelle Donald. I'm a psychosexual therapist who mainly works within spinal centres within the UK, so specialising in spinal cord injury and cord recliner.
Cool. And Sue, hello.
Hi, I have a 28-year history as a specialist nurse working in the oncology setting, so specifically in urology oncology, working with patients who have possibly metastatic disease, so disease that's already spread to their skeleton and maybe in their back. I'm also a psychosexual therapist, and I work specifically in the rehab arena, so anybody that's recovering from an illness or an injury.
Thank you, Sue. Sue Lenon. Right, Areena, you're right below me here, kind of diagonally.
Hi, my name is Areena Dsouza. I'm a spinal surgeon, currently based in Germany, and extremely proud to be part of this team today.
Thank you, Areena. And Lorraine.
Hi, I'm a psychosexual relationship therapist. I work with individuals and couples. I'm not so much in regards to maybe spine and injuries there, but I work a lot with sensual touch, intimacy, pleasure, arousal, stimulation. So it's great to be part of this team.
Thank you, and a welcome, by the way, to both you and Sue, who are here for the first time with us today. You've never been part of our group before, so welcome to you both. Ellie, hello.
Hello, I'm Eleanor Dunstan. I'm a consultant physiotherapist who specialises in spines, lead a team of advanced practice physios for rehabilitation, diagnosis and management of a range of spinal conditions.
Thank you, Ellie. And Angela, right on the bottom here.
My name's Angela Gregory, and I work as a psychosexual therapist in a very busy NHS clinic based in Nottingham. Our clinic, we're more of a generic clinic actually. We see patients from the spinal clinic, but we also see patients from the late effects radiotherapy service, from MS clinic, from a diabetic clinic, and from urology and gynecology. So we're a generic service that sees people with sexual problems from a range of different backgrounds, basically.
Right. Okay. And look at me, the only guy in this group today amongst all these ladies. And so thanks for that introduction. We're going to start with you actually on the first question, if that's okay. And we're going to ask about what the types are. What are the types of lubes that are out there? Let's just have a general little outline of that. So Angela, if you started us off, what's out there?
Right. Well, mainly the main types of lube are going to be silicone-based lubricants, oil-based lubricants, and water-based lubricants. Among those, you can get flavoured lubricants, and you can also get those that cause sort of heat and tingling that can be useful for some patients or people. I think we also need to distinguish the difference between lubricants generally and also vaginal moisturizers.
Okay,
so they have two different functions. The vaginal lubrication to help with penetration, and the vaginal moisturizers should be are used generally regardless of whether women have sexual activity, but if they've postmenopausal, if they're breastfeeding, if they have general vaginal dryness, then it's also useful to use the vaginal moisturizer alongside a lubricant. The moisturizer help to hydrate the vagina, whereas the lubricants help with penetration and sensation.
Okay, thank you. So other people's opinions about different kinds of lubes that are out there, ones that maybe we haven't mentioned, things that we should look out for if we're using certain lubes?
I'd say there's also, you've got anal lubes, which tend to be more thicker. Alongside, there's other lubes, as you were saying there, Angela. And I agree with the warming and the calming and the tingling to implement more sensation. within the experience.
Yeah, there's a mint-based one as well, I think, that gives you that kind of cold sensation. You know, when you put a mint in your mouth and you breathe in, it gives you that sensation in your fooey.
Oh, wow.
I can relate to those. You know, that what's that? The tea tree oil mint original source shower gel I've used before. Where you kind of sort of put it in the wrong place, and suddenly you're like, whoa, whoa.
Yeah.
That's exactly what Sue's talking about.
Go on.
Woo, tingle. The 2-in-1 massage gel. What about that stuff? What's that stuff all about?
I've only come across a Durex, I don't want to mention brand names, but certainly a Durex one that you can use for general body massage as well as a lubricant. So that can be useful if you're doing general massage and sensation touching and you want to then move into some form of genital stimulation or anal or vaginal penetration.
Okay.
So I think if I understand correctly, the 2-in-1 is basically, as Angela said, just a term to sort of say a lube or a massager, which you can kind of use, you know, either or ways. I think that's what it stands for. So yeah, that's a great overview.
Thank you. Thanks, everybody.